Hello friends, Missy Clifton here at Premier Dermatology. I am here with my gorgeous nurse Erin that many of you know. We are going to actually do Erin's lips today. We all know Erin is stunning and she actually has beautiful shape to her lips already. But if we look at her lips really closely, her upper lip and her lower lip are virtually the same size. The perfect lip is actually a lip where the 1/3 of the total volume of the lip is the upper lip and 2/3 of the total volume is the lower lip. So we really want to enhance her lower lip a little bit as far as size. We don't want Kardashian lips. We want really natural, beautiful looking lips like she already has. She has started noticing when she's FaceTiming with family, as we're all doing more of these days, that she's having some little tiny fine lines around her lips that she doesn't like and a little tiny fine line across the top of the lip that she doesn't like. So we'll be filling those as well. So the main focus today is we're going to enhance the actual lip line, the margin of the lip, and that's going to kind of re-inflate those little bitty lines, kind of like inflating in an accordion. It really pulls those lines out. And it'll also just give her lips nice definition. And then we'll just be adding a little bit to the volume of the lower lip. Are you ready? Mm-hmm. All right, very good. And I have a clean ice pack for you to start applying right there for me while I am getting all ready here. We're going to be using Juvederm Ultra today. It's one of my favorite products for lips because it's very soft and natural, and it looks just beautiful. All right, sweetheart, go ahead and take that down. So we're going to start, and we're just going to go right into the white rim of her lip. It's going to be a little tiny pinch. How you doing, sweetie?
Good.
Erin has had some numbing cream on. We don't like to do lips without giving you some numbing because lips are pretty sensitive. And we're just really re-inflating this little white rim right around her lips just to make good and sure she has nice definition back there. Great, you're doing great. That one's a little bit more special right in the middle. Beautiful. Okay, perfect. Now let's ice again right there. Good. And this is one of those tiny little fine lines that she hates. And to really pop those out, instead of going into the line, it's really better to go superficial and kind of go across the line to kind of bolster it up. And that's going to basically make that little guy get completely erased. We'll just massage that in nicely. Beautiful. Better already. All right, my dear. So now I'm going to go from this side. I'm going to go ahead and do a little bit in the Cupid's bow to really re-accentuate that. It's going to be a pinch. We like to really rebuild this, what's called the columella. Great job. Very, very good. Looks beautiful. Okay, now we're going to come from this side to do the lower part of this side of the lip here. You're doing great. Lower lip usually doesn't hurt quite as much as the upper lip. And again, we're just going to get volume here, kind of reshaping that structure of the lip here. To the middle, and then I'm going to come to the other side and we're going to work on the other side a little bit. Beautiful. That looks great. Okay. All right, sweetie. I'm going to wipe you off one more time. All right, now we're just going to come from this side. We're going to rebuild this little vermilion rim. The rolled white margin is kind of what we're going into. One more little pinch here in the middle now, Miss Erin, okay? That one's a bit of a doozy. Great job, you did it. We're going to go in the columella one more time. Here we go. Not as bad there once we get a little bit in there, right? Good, beautiful. Now, smile for me. Good. Yeah, that line is already better. Just by recreating that structure of the lip, it's already popped that little line out. Now, pucker for me one more time. So we got the same tiny little line on this side that we had on the other side. We're going to just bolster it up just a little bit, putting just tiny little amounts right across it. Great job. Beautiful. Okay, now let's go to the structure of this lower lip a bit. Here we go, big pinch. How you doing, doll?
Good.
Ice, ice, baby.
Where are you going?
Right there in the middle. All right. Now there are these normal little pillows in the lip, basically, that if you put filler back where you've lost volume in those little prominences, it really makes the lip look natural and really makes it stand out. So I'm gonna have you open your mouth just really slightly, and we're gonna go right here at the wet dry margin, and we're gonna fill this little pillow over here on the left. And then I'm going to fill it over on the right. Right in the body of the lip. And this edge. I want this little corner to pop up just a little bit, so we're going to do corners for a second, Miss Erin. Beautiful. And this little corner. Excellent. All right, now go ahead and open your mouth just slightly. So at that point, you can actually see she's got nice filling of the lower lip. There's not as many little lip lines there, and the lower lip is actually about 2/3 of the total volume of the lip now. Erin will have some swelling and potentially a little bit of tenderness to the touch that feels like the slightest little bruise. She didn't bleed very much, so I don't think she'll really get true bruising. If she does, she knows that she can come in and laser, and Nellie can laser those little areas to make the bruises go away a little more quickly. We'll give her arnica and we'll have her ice at home 10 minutes every hour for the next day or two while she's awake. And the swelling should go down very quickly. Erin, have you ever had fever blisters?
No.
Okay. If you do have fever blisters or cold sores, we usually treat you with an antiviral medication. Just the act of the injecting sometimes can actually make those pop out, so we like to ask those questions. All right, very good. So be careful eating and drinking over the next little bit because your lips are going to be pretty numb from the lidocaine within there and the numbing cream. And then the last step I'm going to do is just have you open your mouth for me for a moment. And I'm just going to do a little bit of massage to make sure that this feels perfectly even and smooth. And then I'm going to change gloves and do the same thing on the upper part of your lip. Okay, and then now on your upper lip, go ahead and open for me. Perfect. Love it. That looks great and feels great. Let me clean you off one last time. And you are set. Great job, sweetheart. You're so tough. Good job. So that is lip filler.